Hi everyone, this is Dr. B. I'm making a YouTube video to let all of you know that we're reopening our office next week to start seeing everyone again and to start taking care of all of you. We're very excited to reopen the office. I do know that the top concern on everyone's mind right now is infection control and the possible spread of infection at the office. I wanted to reassure everyone that we are doing everything in our power to follow the CDC guidelines on infection prevention, and we are not only following the guidelines, we're going above and beyond. At the office, we've always followed very stringent protocols on sanitizing the office and wiping everything down. We've always done that, but now we're going to start wiping all surfaces in the operatories down twice after every patient with a hospital grade cleaner. And we are also going to concentrate after every appointment and every patient leaves the office to wipe down the reception area, the front desk area, and the patient bathroom with a hospital grade cleaner. We are doing this to make sure that there's no spread of infection when patients are checking out. We will also be going over every single surface with a germicidal UV light. And this is known to kill the virus. There's been research done and it will help sanitize things to a higher level. We are also going to be starting with a soft opening. And the meaning of that is we're going to be seeing fewer patients at the beginning, and we're doing this to comply with the social distancing guidelines. So we'll be seeing only very few patients per day, and we will be increasing the appointment time between patients to help give us more time to clean between appointments and to thoroughly sanitize everything, including the air in the operatories, and also to help with social distancing. Our reception area will be closed. We will be doing curbside check-in. We'll be calling you when we're ready for you on your cell phone while you're waiting in your car, and we will take you right back to the operatory when we're ready for you so that there's no waiting around in the reception area. All staff members will be wearing masks and gloves, so this will be something new. We will also be asking all our patients to have a mask on when they come into the office. If you don't have one, we will provide you with one. And we will ask you to sanitize your hands with hand sanitizer or by washing your hands with soap and water for about 30 seconds. And we will ask you to wear your mask when you're done with your appointment and when you're walking up to front desk for checking out. We will also ask you to again sanitize your hands at that point. We also are not letting any family members in unless you're bringing your child, then of course a parent is allowed in. But any other caregivers or friends or family members, we're not letting them come into the reception area unless they're translating for you, like I said, or they're a parent. We are pre-screening all of our patients with a questionnaire. And this is to prevent anyone who's potentially sick from even coming into the office in the first place. And we are re-screening our patients when they arrive and taking all their temperatures. We're also taking staff temperatures every day when they arrive and logging this in. This is a requirement, and we're going to be doing that daily to prevent any sick staff members from coming into the office. I also wanted to advise any of our patients that are medically compromised or elderly to take advantage of this soft opening time where we are not seeing as many patients as we will be in the future. As our cleaning appointments open up and our hygiene program is filled up again, we're going to be seeing a lot more patients per day. And I think it's advisable for anyone who has a higher risk of infection to come in during this time and have all your work done before we open up to full capacity. The other thing was, if you are talking to Teresa or Rhonda or Heather and scheduling an appointment, request an early morning appointment, request first thing in the morning, which they are already cognizant of this, but I think you also need to just request that you want an early morning appointment to have your dental treatment. So those are some things that we're doing to accommodate our elderly patients and our medically compromised patients, trying to book early morning appointments, and the safest time to come in is when we're seeing the least number of patients. Another way of reducing your risk is by having as much dentistry done in one visit as possible. We've always done that. We've done single visit crowns and single visit root canals, and we will continue doing that for you. But try to have as much done in one appointment as possible to reduce your risk. It's more important now than it ever has been before. I also wanted to point out a big step that we've taken, which you may not be able to see right away when you walk in. And this is cleaning the air in the office, which is a really important step. We have put HEPA filters in all the operatories, and these are high capacity HEPA filters with UVC lights within them, and that's germicidal UV light that kills any bacteria or viruses that are pulled through the HEPA filter. So that's one thing we've done. We've also, in our HVAC system, installed HEPA filters and also ionizers, germicidal ionizers that kill pathogens as the air runs through the HVAC system. I hope this video has helped alleviate any fears you may have had about coming into the dental office and the dental office being a safe place. I wanted to reassure all of you that we are utilizing the latest technology and the most current COVID-19 research to make the office as safe as possible for you. If you have any questions or any concerns regarding all the steps that we're taking to open the practice safely, or if you have any advice or any suggestions on what else we could be doing, please call the office, or you can call me. You can get in touch with me on my cell by hitting the emergency number 8 after dialing the office, or you can web chat with me through our website. These are the best ways of getting in touch with me and just letting me know what you think or if you have any questions. Thank you.